If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
Every who down in Who Newville liked the holidays a ton, but where to get great prices on gifts, they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as Who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Abercrombie Kids is bringing the cheer all holiday season and the gifts too. No matter how long their wish list is, there's always room for just one more. Whether it's a new winter coat, an extra pair of jeans, or cozy matching sweat sets, get gifting with looks they've been waiting for all year. Shop Abercrombie Kids in the app, online, and in stores.
This is Dr. Ted O'Connell with the Med Prep to Go podcast. Today, we'll be reviewing 3 microbiology questions. Just a reminder that you can find these questions online, as well as many other questions on our website at www.medprep2go.com. If you have feedback or would like to get involved contributing to this free online and audio question bank, please contact us through our website. If you like what we're doing, please give us a review and tell your friends, as both of these help us a lot. You can learn more about me and my new books and projects at www.tedxoconnell.com. All right, let's get started with the first question. A 4-year-old girl is brought to the clinic by her parents for pain and swelling in her right eye for the past 4 hours. The patient and her family recently had cold-like symptoms with rhinorrhea and cough that were improving. The mother reports that the patient appears more tired, but has maintained the good oral intake with good urine output. Otherwise, the patient is healthy without prior medical history. She is up to date on her vaccinations and takes no medications. Temperature is 37.6 degrees Celsius or 99.7 degrees Fahrenheit. Blood pressure is 100 over 70 millimeters of mercury. And pulse is 104 beats per minute. On physical examination, her pupils are equal, round, and reactive to light. Extraocular movements in her affected eye are limited by swelling, but are non-painful. Her right eyelid is warm and tender to the touch, with blanching erythema. There is no proptosis. Which of the following is the most likely region infected? A, anterior to the orbital septum. B, inside the lacrimal duct. C, inside the orbital space. D, within the lacrimal glands. Or E, within the meibomian glands. The correct answer is A, anterior to the orbital septum. This patient with swelling around the eye without emergent signs of visual compromise or proptosis likely has periorbital cellulitis, also called preseptal cellulitis. It is infection of the skin and eyelid that most commonly occurs in children younger than 10 years of age. This bacterial infection can occur after trauma or ear or sinus infection. The orbital septum restricts the infection from entering the orbit. Common organisms include Staphylococcus aureus, Streptococcus pyogenes, Streptococcus pneumoniae, and Haemophilus influenza. Children and adults older than 1 year of age can be treated as outpatients with oral antibiotics. Answer choice B, inside the lacrimal duct, is incorrect. Bacterial infection of the lacrimal duct occurs in dacryocystitis. Answer choice C, inside the orbital space, is incorrect. Infection of the orbital space posterior to the orbital septum occurs in orbital cellulitis. Patients have alarming symptoms of decreased visual acuity, ophthalmoplegia, hemosis, and proptosis. Answer choice D, within the lacrimal glands, is incorrect. Inflammation of the lacrimal glands occurs in Sjogren syndrome. Patients typically complain of blurry vision with dry, itchy eyes. Answer choice E, within the meibomian glands, is incorrect. Bacterial infection of the meibomian glands causes hordeolum, which presents as an inflamed, tender papule. A hordeolum can develop into preseptal cellulitis. The key learning point of this question is that periorbital or preseptal cellulitis presents with periorbital erythema and edema, and the infection is anterior to the orbital septum. There are no alarming features such as decreased visual acuity, restricted extraocular movements, or proptosis, which would suggest orbital infection. Question 2. A 52-year-old woman presents to the emergency department with complaints of shortness of breath and a sharp pain that radiates to her neck area each time she takes a breath. She reports that she feels more comfortable when sitting and leaning forward. An ECG reveals no acute changes. Physical examination reveals that the lungs are clear to auscultation, and there is a friction rub heard on cardiac examination. A chest X-ray is negative. An echocardiogram reveals a moderate pericardial effusion. Which of the following is most likely the causative agent of the patient's symptoms? A, Coxsackie virus. B, Mycobacterium tuberculosis. C, parvovirus B19. D, Staphylococcus aureus. Or E, Streptococcus viridans. The correct answer is A, Coxsackie virus. Based on the clinical presentation, the patient likely has pericarditis. The major clinical manifestations include chest pain, a pericardial friction rub, ECG changes such as widespread ST elevation or PR depression, which this patient did not have, and pericardial effusion. In developed countries, most cases of acute pericarditis are considered to be of viral origin. The most common viral infections causing pericarditis are reported to be Coxsackie virus and echovirus. Answer choice B, Mycobacterium tuberculosis, is incorrect. Mycobacterium tuberculosis can cause pericarditis, but is much less common than viral etiologies, and this patient does not have stated risk factors for tuberculosis. Answer choice C, parvovirus B19, is incorrect. Parvovirus B19 is associated with erythema infectiosum, or fifth disease. Answer choice D, Staphylococcus aureus, and answer choice E, Streptococcus viridans, are incorrect. Staphylococcus aureus and Streptococcus viridans can cause infective endocarditis. The key learning point of this question is that most cases of acute pericarditis are considered to be of viral origin, with Coxsackie virus and echovirus being the most common.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite, obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first you need to find the right team. Start your search with Indeed-sponsored jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, Sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Question 3. A 55-year-old man presents to the emergency department with recurrent fevers over the past 6 weeks. Blood cultures are performed and eventually show an organism that is purple on gram stain, does not cause hemolysis when plated, and does not survive on 6.5% sodium chloride. An echocardiogram reveals the presence of native valve endocarditis. For which of the following conditions should this patient be evaluated to determine the etiology of the endocarditis? A. Dental caries. B. Intravenous drug use. C. Malignancy of the lower GI tract. D. Urinary tract infection. Or E. Vegetations on an intravenous catheter. The correct answer is C. Malignancy of the lower GI tract. The blood culture findings in this case are consistent with Streptococcus bovis. Infective endocarditis by Streptococcus bovis is often associated with colorectal cancer. This is in contrast to Enterococcus, which can cause urinary tract infections as well as infective endocarditis. The test to differentiate between these two organisms is growth in 6.5% sodium chloride. Answer choice A, dental caries, is incorrect. Poor dentition is a risk factor for infective endocarditis due to oral flora. Answer choice B, intravenous drug use, is incorrect. Intravenous drug use can lead to infective endocarditis from skin flora, oral flora, or organisms contaminating the drug or materials used for injection. Answer choice D, urinary tract infection, is incorrect. Organisms that cause urinary tract infection are extremely unlikely to result in endocarditis. Answer choice E, vegetations on an intravenous catheter, is incorrect. This patient does not have an intravenous catheter, so that is not a risk factor in this case. The key learning point in this question is that Streptococcus bovis is purple on gram stain, does not cause hemolysis when plated, and does not survive in 6.5% sodium chloride, which differentiates it from Enterococcus, which does survive in 6.5% sodium chloride. Bacteremia or infective endocarditis with Streptococcus bovis is often associated with colorectal cancer. That's it for this episode. Please check out our other episodes, which we are actively recording. Just a reminder that you can also find these questions and many more on our website at www.medprep2go.com. And you can also find additional information on the Crush Step 1 podcast, which you can get wherever you get your podcasts. Hi, everyone. This is Ted O'Connell. I just want to let you know that we have launched a Step 2 qbank podcast, very similar to our Step 1 qbank podcast. Each episode will have 3 questions so that you can study on the go. We are actively recording these and plan to release a new episode every 2 weeks. We're also launching a premium podcast bundle that will include ad-free access to USMLE Step 2 Secrets podcast, as well as early and ad-free access to all of our episodes from the Step 2 qbank podcast. So please go over to our website at medprep2go.com and check these out, or you can access them wherever you get your podcasts. Thanks so much.